And the other point was this combination. One thing that I did not mention, but I think I had it in the for everyone question last time, was about the food effect on the combination. So this actually does affect absorption. Food does affect absorption of the drug molecule and also affect the side effects. Because one of the side effects we mentioned, the cholinergic side effects, is nausea and vomiting. If you have patients with food in their stomach, that's not going to be good, right? So in that case, the combination Cobenfy is taken at least 1 hour before or 2 hours after a meal, right? So this way, they don't have that much food in their stomach. So that's the addition I want to mention in terms of Cobenfy in the combination. So we started looking at anti-epileptic drugs. So the first type of drugs that we are going to be looking at are the drugs for absence seizures, which is also referred to as the T-MAO seizures. So the first class under here is succinimide. Succinimide are 5-member rings with a nitrogen in the ring system and then a carbonyl on both sides of the nitrogen. So this is what the succinimide structure looks like. And you have substitution at the 1-2, like this position here of this here, it says 2-ethyl, right? So this is the 2 position, and then an ethyl and methyl. I feel this is depends on how I guess you because the name is going by succinimide, right? Succinimide is the core structure, so that's why it started from the carbonyl. If it's pyrrole or pyrrolidinone, then you are starting from the nitrogen. Okay, that's the difference in terms of the nomenclature. So the structure, the first one is ethyl succinimide, and this has relatively longer half-life. And the difference between this one and the next one, although the substituents, one is the phenyl, here is an ethyl, but the other difference is the methyl substitution on the nitrogen. So the methyl can be removed, that's a reaction relatively easily done, and also the phenyl ring can be parohydroxylated, right? So this reduces the half-life of the second meth succinimide. So the half-life of this one is only about 2 to 4 hours. It's only about 2 to 4 hours. So in terms of the activity differences, both of these drugs are considered to have relatively, they're relatively older drugs, so they're not that good. So in terms of their use, patients need to be monitored for blood counts, urinary analysis, and liver function. So that means they can potentially have all these effects on the patient's blood and urine, and also liver, in the kidney and liver. So that means the toxicity along those lines need to be monitored. Although this first one, longer half-life, probably is a little bit better than this one for the treatment of absence of T-MAO seizures. So the exact mechanism is unknown for these drug molecules, okay? And then the next drug molecule is just removing, say, this CH2, replace that with an oxygen, right? So that's what this drug is. So there is only one drug under this category of oxazolidine dione, or has trimethyls. So it's trimethyldione, or tridone, right? So this is the trade name, of course, of this drug molecule. Now, and also it does have the methyl group over here, but it doesn't have the phenyl group, right? So that means it has a longer half-life than the earlier one. So it's 16 to 24 hours, but shorter than the other one That means in terms of the one without the methyl earlier in the drug molecule. So, but the demethylated, this metabolite is also active, just as the methoxylamide, that methyl removed on the nitrogen, it still results in an active metabolite because the succinimide itself is active. So this drug also has its problem, toxicity issues, so they're used as the last resort, right, when the other drugs are not working. So the main toxicity issues are fetal malfunctions and toxic to skin and blood. So we're looking at also similar toxicity to probably continuous monitoring, say blood counts and so on is important. So the next drug molecule, probably a little bit more often used, but then it's also relatively simple. So this is actually just more like a fatty acid, but instead of the long chain, straight chain fatty acid, it has a branch. So this is actually dipropyl, so you have two propyl, and then you have acetic acid. So two propyl groups substituted at the alpha to the carbonyl, then it's the carboxylic acid. So this is called valproic acid. Valproic acid, and of course what's used in the clinic is the potassium salt form, or combination of the salt form and the acidic, the acid carboxylic acid form, is 1-to-1 mixture, right? So this is what's used. So this is metabolism-wise similar to other fatty acids. So we are looking at probably omega oxidation and also beta oxidation. So we're looking at the oxidation either at the very end, the methyl group, or at the beta position. So this is alpha, this is beta. So you can have oxidation over there. And this is a useful drug for the treatment of absence seizure and also a complex partial seizure and also bipolar disorder. So you have 3 indications for this drug molecule, including bipolar disorder, in addition to the absence seizure or continuous seizure, and can also be complex partial seizure. The exact mechanism is unknown, but this drug is also known to be associated with high incidence of liver toxicity, hepatotoxicity. And there are also reports of teratogenicity associated with this drug molecule, causing basically fetal malfunction and problems, malformation. And this is believed to be 3 to 20 times more frequent when taking this drug molecule in pregnant women. So in France, for example, this drug is already banned. But in the US, we still have it available, but with the black box warning with this drug molecule. So teratogenicity is a known side effect. And also there is sudden pancreatitis associated with this drug molecule. And this can be fatal if not treated promptly. So this is also, so this drug is not very good, but then still it's used still in the US. So this is just like a fatty acid with 2 propyl groups attached to acetic acid. So the next drug molecule is acetazolamide. Acetazolamide, and it's a new mechanism of action. This is actually a drug that was approved a little bit newer, we're talking about 1995. And acetazolamide, structure-wise, is a sulfonamide. And then in the middle, you have a 5-member ring with a sulfur and then 2 nitrogens in the ring system. So this is thiodiazole, right? Thiodiazole with 1 sulfur and 2 nitrogen, sulfur diazole. And at this side, you have acetamide attached to this carbon. On the other side, it's sulfonamide. So this is a carbonic anhydrase inhibitor. So what does carbonic anhydrase do? So this is actually catalyze the conversion of carboxylic acid, water plus carbon dioxide. So when we breathe oxygen, right, we convert oxygen with what we have in our system during oxidation and convert to carbon dioxide that we breathe out. But in our blood, we actually, in our system, we have an equilibrium between carbonic acid and the water added to carbon dioxide. So this is what this equilibrium is like. It favors, of course, carbon dioxide. You can breathe a lot. So, but this is a carbonic anhydrase that catalyzes this conversion, right? In both directions. In both directions, you're inhibiting this carbonic anhydrase. So when this is inhibited, so in the urine, you actually have more elimination of carbonic acid. So that means it's going to be, so bicarbonate, more eliminated in kidney. So what that will do, right? It will bring sodium ions with it. That can change the pH of the urine, actually increases the pH of the urine. So this is one effect. The other effect is it can decrease the concentration carbonic acid in the eye. What would that do? That actually helps decrease the secretion in the eye and help reduce eye pressure. So this drug is used to treat petit mal seizures. So this is under petit mal seizures. In addition to that, it can be used for the treatment of glaucoma. Glaucoma is high, like eye kind of pressure in the eye, right? So this actually can help decrease the pressure in the eye for glaucoma and also acute mountain sickness in climbers. Acute mountain sickness, so you have to go, say, to a high up in altitude, and this can that can cause like mountain sickness for the climbers, and this acetazolamide is one of the drugs that can be used to combat that. And the other effect is the increase in pH, right? That actually can help dissolve, for example, cysteine, L-cysteine in cystinuria patients. Because cystinuria patients are genetic disorder. These patients eliminate a lot of the L-cysteine into the urine and can crystallize in the kidney and cause kidney stones, right? So you elevate the pH, and that can help increase the solubility of L-cysteine. So that's another effect that people have, doctors have prescribed for like cystinuria. So the mechanism is very different. So carbonic anhydrase inhibitor, right? So medical use, what you see related to that action. So there are several benzodiazepines that can be used. One listed here is clonazepam. Clonazepam has a nitro aromatic. We mentioned about nitrobenzene rings, right? That can potentially cause problems, but this is one of the few drugs that has the nitro that can be reduced. And then you have a chlorine on the other substitute, on the other phenyl ring. So most phenyl ring has electron withdrawing groups on them, so they don't get metabolized that much. You have a sweet position that can be hydroxylated. So clonazepam is used for petit mal seizures. There are other benzodiazepines can be used to treat a variety of different seizures. We are not going to be talking about them, but I'm just going to be mentioning them here. So diazepam, for example, can be used in treating many types of seizures, and can be also used in combination with another drug we'll mention later on for status epilepticus. Right? That's an emergency situation. Benzodiazepam, diazepam can be used in combination. Lorazepam, when you have the lorazepam, that can be used also for the treatment of seizures for its longer duration of action. Chlorazepate is also used to treat seizures, but in that case, it's more for partial seizures. So we do have benzodiazepines, but here we're just looking at chlorazepine. So next, are drug molecules that are used for partial and grand mal seizures, right? Partial, we said, it's originated from part of the brain, one side of the hemisphere, and the other one, grand mal seizures, is more like kind of on both sides. It involves the whole body of the patients. So we have barbiturates. We have, the first one is long-acting barbiturates. So this is phenobarbital. This is probably the only one left now, which is known to be good for grand mal seizures, but this is not good for petit mal seizures. So you can see different seizures require different medication. Of course, it's a longer duration of action, so we're looking at 10 to 16 hours. And then there is esoteric barbiturates. The only difference between phenobarbital and then this one, primidone, is the carbonyl between the two nitrogen here is replaced by CH2. Right? So this is considered to be bioisosteric replacement. But because the CH2 can be oxidized, so it can be oxidized through hydroxylation, and then it can be oxidized further to CO double bond. That would be phenobarbital. L can also be kind of cleaved between the carbon and nitrogen bond, and then also cleaved on this side. So it will give you maleimide. So that means this malonic acid with two amides attached on each side. So that's also considered to be an active metabolite. So this is actually the major metabolite. And this is minor metabolite. But both are active. Okay, both are active. But this parent drug is active. So this primidone is not a prodrug, right? So because this is also active, you do have two active metabolites, and that is significant amount of these are converted to the active metabolites. We have 40% of the drug eliminated unchanged. So that means the other 60%, a majority of that 60% is going to be converted to this diamide, and the rest is probably going to be the minor metabolite is the phenobarbital. So this is a drug that's used for partial and grand mal seizures, right? So this is listed under partial and grand mal seizures. So the next class, and actually there are 3 drug molecules under here, is the hydantoins, right? I mentioned dantrolene has a structure of hydantoin. So what is hydantoin? This is the structure of hydantoin. It's a 5-member ring with 2 nitrogens in the ring system, and then 2 carbonyl. And then you have a CH2 between the nitrogen and also a carbonyl, and oftentimes you have substitution on that carbon. So it can be 2 phenyl rings, or can be just 1 phenyl ring substitution at this carbon here. So this is considered to be the 5th position. This is 1, 2, 3, 4, 5, right? The 5th position. So phenytoin is the one that has 2 phenyl rings at the 5th position. So actually these hydantoins are good for different kind of seizures. Of course, we are looking at grand mal seizures here mostly, right? And also partial seizures. So you're looking at the for this hydantoins, they are usually good for grand mal seizures. Okay, probably more preferentially for grand mal seizures. May have some effect because it's listed on partial seizures as well. So the mechanism is a little bit harder, not very well understood, okay? It's related probably with the sodium channels that can probably affect the seizure threshold. That means stimulation when it reaches that threshold, but with these drugs that can elevate that threshold, so it's not likely to produce the seizures. So these two phenylrins are identical, right? So that means in this drug molecule, it doesn't have a chiral center. So, but then if when you have two phenylrins, there is a chance of metabolic hydroxylation. So one of the phenylrins will be hydroxylated, and that gives you a chiral center. So in this case, hydroxylation is going to happen to one of the phenylrin, and now you have a chiral center, and that center is going to be most likely S configuration. Because when this binds to the enzyme, hydroxy group is added to only one side, right? So that means because it's enzyme catalyzed reaction. So the drug molecule half-life about 22 hours. So the oral bioavailability is somewhat erratic. So we're looking at 57 to 86%, right? So some erratic oral bioavailability. And this drug can be used for grand mal seizures, is also indicated for status epilepticus, and also for the prevention and treatment of seizures occurring during neurosurgery, right? So when patients undergo surgery into the central nervous system, into the brain, that may lead to seizure. So this is one of the drugs that can be used to treat and also prevent those seizures. We know that status epilepticus is an emergency situation, right? So we cannot really do it by oral administration. So we have to convert this into an injectable. But this is a drug molecule, the only acidic functional group, right? This is the hydrogen here that can leave as a proton. But this acidity of this proton is relatively weak acidity. In order to keep this in solution, so the formulation requires a combination of alcohol, 40% of propylene glycol, and 10% of alcohol, ethyl alcohol. And also you need to have a pH of about 12 in order to keep this in solution. Imagine injecting something that has a pH so alkaline, like 12, and with all these alcohol in there, right? It's very painful. So it's not an easy injection to do. So that's why the next drug molecule is using a prodrug approach to increase its water solubility. So what it did is to remove the hydrogen here and add a CH2 and then attach a phosphate to it. Now phosphate is acidic functional group. It easily forms the sodium salt. Now it's highly water soluble, right? So you can do the injection, and this is phosphanidate, right? Phos, that means it's a phosphate, right? Phosphanidate. So after injection, you have alkaline phosphatase that can cleave the phosphate off. And now you have hydroxymethyl attached to the nitrogen, and that will just fall apart to give you the aldehyde and the current drug molecule. So this is the drug for status epilepticus and also for seizures occurring during neurosurgery, right? So an emergency situation, so it's ready for injection. So the next drug molecule is acetylcholine. So it's an ethyl group on the nitrogen here, and then you have a phenyl, one phenyl ring at the 5 position. So the ethyl group apparently can be metabolized to be removed, and then you can have hydroxylation on the phenyl ring, right? So those are the reactions that metabolic reactions can happen. So this drug is used for grand mal seizures, and psychomotor seizures. Psychomotor seizures. So these are the Hayden twins. So now the drug molecules that belong to dibenzazepines. So you have two benzene rings fused with, in the middle, a 7-member ring with one nitrogen on it. And then you have another carbonyl and then an H2. So this is a urea, right? Urea at the bottom. You do have a double bond on the top. So this is a drug that's used for actually grand mal and partial seizures. So it's not effective against petit mal seizures. But in addition to that, it's also good for bipolar disorder. Right? So this is also good for bipolar disorder. And this is metabolized through cyclone P450 by adding an oxygen across the double bond in the top here between the two benzene rings. Right? This is relatively easily accessible, and also two benzene rings, they're not part of the aromatic system, like these double bonds in the benzene rings, right? So this is relatively an easy oxidation, right? You have the epoxide form, and the epoxide then can be hydrolyzed to the diol. So the epoxide is also active. So this is an active metabolite. And then what's known about this drug molecule is carbamazepine. It can induce its own metabolism. So that means that when patients, after using it, it will produce more of the metabolite as patients continue to use it. So the half-life of the parent drug molecule is 25 to 65 hours. And the active metabolite, the half-life, is greater than 30 hours. So actually, in terms of its half-life, right? So both are going to contribute to its activity. So the mechanism of action of this drug molecule is not very well known, not very understood. Could be related to the sodium channel, just like some of the earlier drug molecules, sodium channel inhibition. And one problem with this drug molecule is agranulocytosis. Agranulocytosis. Agranulocytosis and also aplastic anemia. So these are two side effects that this drug may cause in patients. So the diol is inactive. So the next drug molecule is topiramate. Now this is a drug not much to talk about, but it's actually relatively more recent. So we're looking at 1996, a drug that's approved. But this is more like a protected sugar, right? So in the middle, you see you have 5 carbons, 1 oxygen in the ring, and you have another methyl here. So it's a 6-carbon sugar. And then on this hydroxy, you have a sulfonate. Like this part is it's an amide. Like on this side, it's still an ester, so it's sulfonate. And then you have acetone forming this kind of 5-member ring with 2 oxygens in the ring system. So this drug molecule is used to treat partial and grand mal seizures. The exact mechanism, not very well known, but could be related to inhibition of the sodium ion channel and also potentiate GABA activity in terms of more like the barbiturates or benzodiazepines, but we don't know where the binding site is. So that means enhance the binding of GABA to GABA receptors. So interestingly, this drug is not extensively metabolized. So we're looking at 70% of the drug eliminated unchanged in urine. So this is topiramate. Some newer agents, we're looking at probably the first one here, proleptanil. So this is a drug that was approved in 2012. So structurally very unique, different. You have more or less 4 aromatic rings attached to each other, right? 4 aromatic rings, 2 pyridine, and then this pyridinone, and then you have also a cyano group on one of the phenyl ring. So this is a drug used for partial onset seizures and also for grand mal seizures. In terms of age limitation, there is somewhat different, like partial seizures for patients like 4 and older, 4 years and older. For grand mal seizures, we're looking at 12 years old and older. And this is a mechanism-wise, it's a non-competitive. And PA antagonist. Right? And PA receptor is a glutamate receptor. So in order to produce more CNS inhibition, you need an antagonist. If non-competitive means it's not binding to the glutamate binding site, right? So it's going to be off-site, and actually non-competitive means with glutamate bound or not, and this compound will bind to the receptor and cause antagonistic activity, right? So that's why it's called non-competitive. So this drug molecule has a long half-life. So we're looking at 105 hours. 105 hours. So it's really once a day dosing. So it's 5 compound. So this is a drug molecule, a long half-life, and also a relatively large, a new mechanism of action. So metabolic reactions, what we are looking at with the phenyl rings, right? You have phenyl rings and you have aromatic rings. So that means it's going to be probably oxidative metabolism and then followed by conjugation reactions. So this is proleptanil. So the next drug molecule is the cosamide. Now this drug molecule is kind of like an amino acid in a protected form. So what you see, this is like amino group. This is usually alpha amino to carboxylic acid, and this is with 1 methylene on the side chain and there's oxygen. So this part is actually this is a serine, but the stereochemistry is the opposite of the natural serine. So this is D-serine with this stereochemistry. And now, of course, you have a benzoamine attached to form the amide, and the nitrogen is acetylated to give you acetylamide, and the oxygen is methylated. So it's like a very protected D-serine. So very high oral bioavailability, almost 100%. So this drug has a half-life of 12 to 16 hours. So then this drug is for BID dosing, twice a day dosing. So how this drug works, first of all, this drug is used for partial onset seizures and also for the treatment of grand mal seizures. So the exact mechanism is also not known, not very well understood. So elimination is through urine, and with 90% of the drug eliminated through urine, and about 40% of the drug remain unchanged, and the rest eliminated as metabolite. So this is lacosamide. Now, the drug molecules just for partial seizures. So the first one here has similarity to the one that we talked about just on the last page, the dibenzapine, so carbamazepine. So in this case, it's oxcarbazepine. So oxcarbazepine, so the difference, instead of the double bond, at this 9 and 10 position, it is a carbonyl at one of the carbon, right? In this case, a 10 and 11 position, right? This is 10 and 11. So nomenclature starts one from here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 11, okay? 10 and 11 on the top. So this is known to be a prodrug. This is known to be a prodrug. So that means after administration, it's going to be reduced. Right? This is a carbonyl, still double bond. Reductive activation of this drug molecule to give you hydroxy attached to the 10th position. The rest of the structure is the same. So this is the active metabolite. So this is called licarbazepine. Licarbazepine is the active metabolite. Since licarbazepine is active, so what later on was another drug that was approved. So this was approved first in 2000. This is the next drug called licarbazepine acetate, and also called Aptium. The brand name, Aptium. So this drug molecule is a prodrug with an acetyl attached to the hydroxy. Right? Acetyl attached to the hydroxy, and the hydroxy is only pointing towards you with the S enantiomer. Right? So this is the prodrug form, and now the acetate is given, of course, hydrolysis of the acetate ester will activate the drug molecule. So Aptium is once a day dosing. With this drug molecule, it's a once a day dosing. So these drugs are approved for partial seizure, and the in terms of the mechanism, probably the sodium channel, right? So that means not probably very well understood. So the metabolism resulting into the hydroxy metabolite is the active species for both of these two prodrugs. So the next drug molecule is tiagabine. Now tiagabine, structurally somewhat different from the other drug molecules. This was 1997, it was approved. And this also has a unique mechanism of action. So it actually inhibits reuptake of GABA. Right? So GABA is the inhibitory neurotransmitter. If you decrease the reuptake, so more of the GABA will stay in the synapse and activate receptors, GABA receptors, and cause CNS inhibition. So this is the new mechanism of action, and this drug is extensively metabolized with only 2% eliminated unchanged. So the metabolic reaction related to this drug molecule, the many oxidation on the silophene ring, and then you can have glucuronidation, right, on the right-hand side of the carboxylic acid can form glucuronide. What's happening in the middle double bond you don't see much oxidation because this is kind of hidden in the middle of the structure. Not like the earlier drug molecule was double bond between the 10 and 11th position, right, in the carbamazepine. So those are carbamazepine, that's that was the double bond. So that's more exposed, but when you have a double bond in the middle of the structure, usually you don't see much really metabolic reactions. So this is used to treat partial seizures. All of the drugs over here, the partial seizures and a couple of other drugs later on will add some other functions, some other indications. Felbamate is the next drug molecule. So this was approved in 1993, Felbamate. So this resembles to what we have seen before, the propamate. For propamate, we have substitutions in the middle carbon, but here it's just have a phenyl ring in the middle carbon. And you do have two carbamates in it, but then this drug molecule is used for partial seizures. It's related structurally to carbamate, but this, we know to propamate. The propamate is a controlled substance. This one is not a controlled substance. So that indicates this drug molecule does not have tolerance issues, right? So there is the, after prolonged use. So there are some risks of this drug molecule having aplastic anemia, and also acute liver failure. And because of these potential issues, so this is not a first-line treatment of partial seizures, right? So because of these the problems. So the exact mechanism is unknown how this drug works. So the next drug molecule is lamotrigine. Lamotrigine structurally is interesting because you have two amino groups onto this triazine, and you have two chlorines attached to the benzene ring, right? Two amino and two nitro groups, two chlorine atoms. And this is a drug that was approved in 1994. This is used for partial seizures again. It could be related to the sodium channel in terms of how it works. So that also means probably not very well understood. But in terms of the two amines, the unique feature is when it undergoes glucuronidation, this is the one that undergoes glucuronide formation, right? While the other one, so you have 1, 2, 3, 3 amino forms glucuronide, and the 5 amino does not readily form the glucuronide, maybe because of the bulkier phenyl ring next to it, right? So that's probably an interesting elimination, interesting glucuronide formation. Only one of the two aminos more exposed. So you can see an enzyme doing the catalysis. It only works on the more kind of accessible functional groups. So the next drug molecule is gabapentin. So you look at this drug molecule and also the drugs after this, right? So this is gabapentin, and the next drug also pregabalin, right? Both are derivatives of GABA, right? You look at the structure, this is gamma aminobutyric acid here, and here you have gamma aminobutyric acid, right? Pregabalin, all this gabapentin, they're all trying to mimic GABA, right? GABA derivatives. But their studies found out that the action of these drug molecules doesn't seem to be working on anything related to GABA, right? So that means it's not working on GABA receptors, not working on GABA transporters. So it doesn't seem to be working related to GABA in terms of its function, but the end result, okay, is actually kind of increase in CNS inhibition. So they're used for partial seizures. So for the first one, gabapentin, in addition to partial seizures, this is first of all approved in 1993, also for post-hepatic neuralgia. So it's kind of a neuropathic pain we are looking at for this drug molecule. So it doesn't mimic the GABA metabolism. Very little of the drug molecules metabolized, so mostly eliminated and changed. So the mechanism is unknown. The problem with gabapentin is its oral bioavailability decreases with increase in dose. Right? So that's a variability that you see in patients. So there seems to be a saturation effect. So that's why the drug molecule have been converted to a prodrug. So what happens is attached, this is attached to this nitrogen, right? So you form a carbamate with this nitrogen and extend it with an acetyl group here with two oxygens and then another carboxylic acid forming the ester. So this is gabapentin. Gabapentin enacarbil. So this is the trade name, Horizon. So this prodrug is also known as, in terms of its activation, it will start from the left-hand side, right? Cleave the ester bond. Once it's cleaved, then it falls apart sequentially for releasing the acetaldehyde, maybe oxidized to acetic acid, and then releases carbon dioxide. So it's a series of reactions. So this is what's called cascade prodrug. So it's a form of cascade prodrug, right? So you are going to activate and you are going to have the a series of reactions that can happen to it. So this drug molecule is indicated for moderate to severe restless leg syndrome and also for post-hepatic neuralgia. Although it did not say it indicated for partial seizures, but it might have a similar effect, right? Because it's activated, but it's not just indicated for that. So it's for restless leg syndrome and post-hepatic neuralgia. Similarly, with the progabalin, right? It's a derivative of GABA, so it does not relate to GABA activity in the central nervous system. But this drug is well absorbed after oral administration. Very little metabolism of this drug molecule, so it's going to eliminate mostly unchanged. So this drug is for partial seizures, neuropathic pain, and post-hepatic neuralgia. Okay, the last page. Oh my God, I have more than 2 pages. Okay.
You could just end it. You could just end.
The next one is zonizabin, and all of this you can see is a sulfonamide, right? You have a sulfonamide, and the drug, of course, is indicated for partial seizures. Not much to talk about related to polysodium channels, but this you have to know, right? Levotiracetam. This is the capula, right? This is a known, often used drug molecules for partial seizure. And also, this drug has a trade name called Spiritan. This is actually a 3D printed drug molecule that's approved by FDA. I think this is probably the only one so far, right? It's already was approved. Maybe there are others that I don't know, but this is like was approved in 2015. Right? 3D printing, so this actually has quick, rather dissolve, quickly dissolve. It's just like a little bit of liquid would quickly dissolve in the central nervous system. In the mouse, and of course go into the central nervous system. So the mechanism is unknown, but it's known to work on synaptic, what's called SV2A. SV2A, it's a glycoprotein called synaptic vesicle protein 2A, right? So this is actually causing the inhibition of calcium channel, presynaptic calcium channels, and reduce neurotransmitter release and acting as a neuromodulator. So this drug can be administered by IV and also by oral administration. So the next drug, the major metabolism is related to this amide. So the amide, once it's hydrolyzed, will give you the carboxylic acid. And the next drug molecule, the only difference between this levortiracetam is this purple group, right? So the rest of the structure is the same. So this drug, rivaroxaban, so is a drug molecule that works on the same SV2A, the same as presynaptic synaptic vesicle protein 2A. And also the metabolism is similar in terms of metabolism we're looking at here for hydrolysis of the amide bond. So of course both of these two drugs are used for partial seizures. So the next drug molecule, ezogabine. So this is structurally very different from the other ones, and mechanism-wise is also very different. So this is considered potassium channel opener. Potassium channel opener. How does it relate to the control of epilepsy is not very well understood, but this is an add-on treatment, so often used in combination with other medications to treat partial seizures. So it's a very different mechanism of action. So extensive metabolism with a half-life, we're looking at 7 to 11 hours. So main metabolism relate to acetylation. Acetylation here, this is the amine, acetylation. And then also glucuronidation. Can happen to the primate Morris amine, aromatic amine. Okay, now the last page. Now, very important drugs. And the first one is cannabidiol, right? There are two drugs that natural products isolated from, related to. What is it called?
Cannabis?
Cannabis, right? So this is cannabis.
Go home, bro.
So this is, we talked about one last semester, that's for nausea and vomiting. And this is one for seizures. Now this is mainly for actually 3 different kinds of seizures, for rare and childhood onset seizures. They are all genetic disorders. One is called Dravet Dravet syndrome, and also Lennox-Gastaut
Ain't no way. Bro, just pull shit out of his
syndrome, and also tuberous
He's making it up.
sclerosis complex. So these are both are syndromes.
Okay, thanks, man.
So these are the three conditions that actually this drug can be indicated for. So Dravet syndrome and Lennox-Gastaut syndrome, and then these are all kind of epilepsy in childhood development issues associated with developmental issues. Okay, so this is the drug that's that was approved. Of course, this is 2018 was approved
Does he know he's overtime?
from cannabis, isolated from the cannabis. The other one, of course, is the THC, right? That's also a natural product. So the next drug molecule is magnesium sulfate. Now, this is the drug molecule given by only injection, so we're looking at IV or IM, but the problem with IM administration, it's very painful, so that's why it's most often used by IV administration. So this is used for eclampsia. So eclampsia is a rare condition affecting women at the end of pregnancy or right soon after childbirth, when the patient's whole body is involved in convulsions and can go into a coma, right? So this is a very life-threatening situation. So magnesium as a CNS depressant actually is given by IV administration and given to these patients. It's the treatment of choice for eclampsia, right? So this is the current management of eclampsia. So the next two drug molecules, actually three, are related, and also interestingly, I think they are also related to the conditions that we discussed before, tardive dyskinesia, right? That's the side effect associated with some of the antipsychotics, mostly first generation antipsychotic drugs. And this is the tetrabenazine. Tetrabenazine with methyl attached to the oxygen. So it's methoxy here. So this is tetrabenazine. That's a drug that's used initially. But the problem with tetrabenazine is it's going to be demethylated through oxidative demethylation reaction. And it's going to be then inactive. And the other minor metabolism is the carbonyl that can be reduced to the alcohol, right? So this drug, once administered, even though it's highly orally bioavailable, but very little of it is detected in the patient's blood, because the first pass metabolism will remove in the methyl groups, right? So very low and erratic in terms of systemic bioavailability due to first pass metabolism. So one of the drug, the first deuterated drug is this deutetrabenazine. So that replaces the hydrogens on these methyls with deuterium. This is the first deuterium drug that was approved in the clinic, deutetrabenazine. And of course, this is the drug that's approved for a couple of Huntington's disease, horror related to Huntington's disease, and of course also the Tourette syndrome when to control the tics, and also tardive dyskinesia, these movement disorders, the side effects associated with first generation antipsychotics. With the CD3 attached, so demethylation is less likely to happen. So metabolism now mainly focused on the carbonyl. So this is the carbonyl that's being reduced. This is referred to as metabolism switching, right? You switched actually metabolism after replacing the hydrogen with deuterium, because this is less likely to happen. Now the reduction is more likely to happen. After reduction to the alcohol, right, this is active metabolite. It's an active metabolite. Now the next drug molecule is just using the active metabolite, although without the deuterium in it. So this is the, with an amino acid attached to it. So this is valine, so it's valbenazine. So this is a prodrug, right? So once this drug is administered, you're going to have esterase catalyzed hydrolysis. You're going to release the hydroxy metabolite, which is the active metabolite, although it still has the methyl CH3 on this, but it's not the first pass anymore, right? So it's already going through the system activated in vivo. So this drug was approved in 2017, mainly for the treatment of tardive dyskinesia. Okay, so I just want to mention these drug molecules being important. Sorry, I did take about 9 minutes extra in the last lecture. Okay, so
credit.
just want to give you the last one, maybe another minute.
I think I know that.